because it was the exit. Thank God.
Yeah, thank God. Imagine
Hello, everyone.
Happy New Year.
Happy New Year to you as well. Thank you.
Happy New Year.
Happy New Year. Excuse me. So, how was the Christmas, New Year, everybody? A good time? Yes, no?
Mm, Not really. Kids being sick.
Oh my goodness, that's not fun. I also had the same scenario like everybody at my home. I think last 20-25 days, the cycle's been like on continuously. It's like it starts from first one, as soon as the last one starts feeling better, the first one gets sick again. It feels like I'm getting in that zone again. Third time. And my wife is kind of in the middle, so I think I'm gonna replace her now. It's no fun. And these bugs, like this time, they are quite strong and they don't leave you alone like for many days. Excuse me. We'll give another minute or so and then we'll start. And if you guys could please turn your cameras on, unless whoever got a permission previously to keep it off, so that I can see you guys. Okay. Do you guys remember what slide we were on, which question we were on in the last session? Anybody remember?
I think it was a seizure terminology.
Seizure.
I think it was number 37 or 30.
Okay, let's see. So it should be somewhere here. Let's see if you can can you take a look if we did this question? I completely forgot what question we were on. Do you guys remember doing this question? Excuse me. Any idea, guys?
I believe the last one was talking about seizure medication.
Seizure medication. Let's see. Oh, this one?
Yes.
Perfect. Thank you, thank you, thank you. Perfect. Oh, great, 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 great. And thank you guys for keep working on your assignments during the holidays. Um, I had no intention to bug you guys during the holidays, but trust me, it's gonna help you big time working ahead. Um, because I always looked into this, when you are in the week 7 and you have exam in week 8, and when you have too many to work on, it just kind of, acts as a distraction, a hurdle to prepare for the actual final exam. Your mind is somewhere stuck in those assignment, between assignment and preparing for the exam. You're going back and forth, back and forth, back and forth. And that is the reason that I kept them open during the holidays, so you can keep working on. But if anybody did not submit week 4 assignment, uh, you are still not late. You can still submit your assignment without any deduction in any of your points. Okay? It's just giving you that opportunity, freedom to work ahead, and then wrapping it up early so that you have more time to prepare for your final exam. So please don't excuse me, tell your mind that yes, I'm ahead, so let me take a break and then I'll catch up next week. Please keep working ahead. Okay, that'll be real helpful, trust me. Okay, ready, guys? Yes. Excuse me. So I had only one student who asked permission for like keeping the camera off for the first 30 minutes, but there are many cameras off. I don't want to name anybody, but all of you, as your cameras off, please turn your cameras on.
I'm driving, Professor. Can I turn
No
on when I
problem.
reach? Okay.
No problem. If you're driving, be safe.
Okay, thank you, Doc.
Okay. Alrighty. So let's move on. Let's do this question again. I don't know if you guys remember that or not. So you guys want to answer this? Real quick. An easy peasy one. Great, great, great. Perfect. Yes, excellent. Okay. All right, perfect. Yes, C is the correct here. Status epilepticus. It's a medical emergency when the patient experiences prolonged or repeated seizures without having a recovery period in between. Okay. All right, let's move on to next one. Let's try to answer like in 30 seconds or so, 30, 40 seconds the max, so that we can do more questions, okay? Excuse me. The patient diagnosed with depression, given MAOIs, monoamine oxidase inhibitors. Which of the following medication are examples of monoamine oxidase inhibitors? So we can identify. Nice, great job. Proud of you guys. Well done. Yes. C, phenelzine, isocarboxylate, tranylcypromine, and selagelin. These are your MOIs. And MOIs, whenever you see them, always be careful in real life as well. They're high risk. They have many interaction with foods and drugs, and patient could be at high risk. Okay. Next. So nursing instructor teaching a group of nursing students about SSRI, selective serotonin reuptake inhibitors for depression. Which ones are those? Okay, looks like everybody's on the right track. Good job. Yes, A. Fluoxetine, which is Prozac, sertraline, paroxetine, escitalopram. Those are your SSRIs. In NCLEX, they always want you to understand this point. Whenever you're starting any depression medication, including these SSRIs, SNRIs, anyone you're giving antidepressant, make sure highest priority is patient safety. They're at a high risk of suicide in the beginning. Always keep that in mind. Okay, how about this question? TCAs, tricyclic antidepressants. These are also quite fatal. They're also high risk. Actually, there is a, I'm sorry for a little issue here. Citalopram is not, the correct answer is B, but I'm sorry, I put citalopram. Citalopram is a SSRI, but the other ones are TCAs. Your nortriptyline, imipramine, and desipramine. These are your TCAs. And TCAs, you have to be very careful and kind of, early signs of toxicity, because it could be real fatal. Patient may not even be able to make it up to the hospital. So if the dose is quite high, not, I mean, if it's close to the borderline, but this becomes fatal quite quick. Okay. So please take out citalopram out of option B, and the other three are your TCAs. Okay. The patient has Parkinson's. The drug combination uses dopaminergic agent for managing symptoms of Parkinson's disease. Which ones are those? So in this disease, patient has less dopamine, so you need to give them dopamine. They have more acetylcholine, but less dopamine. Great job. Yes, proud of you guys. A is the correct one. Levodopa, carbidopa, that's, if somebody asks you what is the drug of choice in Parkinson, that's your levodopa, carbidopa combination. Because your levodopa gets converted into dopamine, and carbidopa saves levodopa from getting wasted and allowing more of the levodopa reach the brain. That's why it's given in combination. Carbidopa is in a lower dose along with levodopa. Nice. Which is used for partial seizures? Great. It's majority of you answered correctly. D is not the correct choice. Clonazepam is not used for that purpose. So you may see some drugs which are from that class, but not all. Okay, so A is the correct choice. So your phenytoin, gabapentin, lamotrigine, topiramate, these are all used for seizures. In others, there one or another is intentionally mixed with other drugs. For example, carbidopa, levodopa, not for that. Lorazepam, diazepam, baclofen, not for that. Same on the D-clonazepam, not for that purpose. So A is the correct choice. Okay. Nurse is providing discharge teaching to patient who's given phenobarbital for seizures. Which statement by the patient indicates the need for further teaching about the medication's potential adverse effects? So you are looking for incorrect option here. Sorry, I didn't ask you. You guys can see my full screen, right? Yes. Okay. Thank you. Okay. Yes. Everybody answered correctly. D is the correct choice. Nausea, vomiting is not a reason to skip a dose. Okay. It's always safe to avoid driving until the patient know how it is going to affect them. Okay. All right. Excuse me. Now here's phenytoin. Patient education given about that. Which complication the nurse advised the patient to prevent by performing frequent oral care? Why they need a frequent oral care? Okay, well done. Yes, great job. It's the gingival hyperplasia. Okay, that's very important adverse effect associated with phenytoin. So you need to educate your patient to watch for signs and symptoms of gingival hyperplasia. If you search on maybe Google images, you will see swollen gums and they can bleed. So you need to tell them that this condition, happens because of that local contact with the drug. So in order to minimize that, the contact time, the period, you need to perform frequent oral care. That's a very important point for NCLEX. They usually look into that. If they come with phenytoin, other important thing is knowing about signs and symptoms of phenytoin toxicity, phenytoin's therapeutic levels, because phenytoin is also one of those drugs which has a narrow therapeutic index. In the whole course, I think you have maybe 8 or 10 drugs which you need to know for NCLEX, even in real life scenario. 8 to 10 drugs which has narrow therapeutic index, and you should know the lab values like warfarin, digoxin, phenytoin. These drugs, they can become toxic real quick. Excuse me. Okay, next. You as a nurse providing teaching about adverse effect of anticholinergic medication. Now, which statement indicates need for further teaching? So once again, you need to look for incorrect option. For this, you need to know what are the anticholinergic medication, how they work, where do they work? They're anticholinergic, so they block the cholinergic receptor. Remember one thing, if any drug is cholinergic is gonna make your patient wet, means their secretions are going to increase. For example, somebody's having allergies and stuff, so acetylcholine more, their watery nose, eyes, saliva, all that. Anticholinergic, example, Benadryl. How do you feel after taking Benadryl? Dry, right? That's what you need to know. Okay. Perfect. Okay. So D is a correct choice here. Okay, guys. Next. Now you are providing education to patient. Dentrolin for muscle spasticity. Which statement by the patient indicates need for further teaching? Once again, looking for incorrect option. Like A is correct. Taking this medication with food can prevent that GI upset. Avoiding alcohol is also very important. Why? Because this drug alone or taken with alcohol can increase the risk of CNS depression, central nervous system depression. Okay. Reporting yellowing of the skin, eyes, that potentially indicates what? Hepatotoxicity. Yeah, it should be reported promptly. D is the right choice, or you can say the wrong statement. Okay. All right. Once again, patient education who's diagnosed with overactive bladder. Bladder is more active than normal. Which of the medication most likely prescribed for this condition? Excuse me. Now, patients, bladder is more active. You need to make it less active. When they're more active, they're gonna go pee more. So you need to reduce that by giving them an anticholinergic medication, and it's oxybutynin. It comes in patches as well. Okay, it reduces the involuntary bladder contractions. So it allows longer time, prevent urgency, decrease the frequency of urination and incontinence patient. Okay, tamsulosin is Flomax, which is used for older male for BPH, benign prostatic hyperplasia. Same finasteride. Nitrofurantoin is not used for that. It's an antibiotic used most commonly for UTI infections. So the correct one is oxybutynin. Right? Everybody's clear? Any questions so far, guys? Anything which didn't make sense to you? Everybody's doing all right? Yes? Okay. If anything you don't understand, please speak up, okay? Don't waste for everything to be completed. Anytime it doesn't make sense to you, you need more clarification, just let me know. All right, let's do the next question. Now, you are taking care of a patient diagnosed with urinary retention. Means they're not able to pee. They have an abnormal bladder, neurogenic bladder. So they gave them botanical. Which statement the patient indicates the medication is effective? Okay, once again, good job. Yes, A is the correct choice. Now the bladder is not normal and the patient is not able to empty the bladder. So you're going to give them a cholinergic agonist, which is botanical, which allows them to stimulate the bladder's detrusal muscle to improve the bladder tone and function so that they can go pee. Okay. And it's also used in patients after surgeries, post-operative urinary retention. So in that scenario, you may see this drug given as well. Okay. All other statements are not correct. Saying I no longer have to wake up. Well, no, if it's gonna make you go pee, you gotta get up. Patient's output, the urine output is going to increase, not decrease here. Okay, the patient old, 65-year, history of hypertension, chronic stable angina, taking metoprolol. Now, metoprolol is a LOL beta blocker, right? So during the patient's follow visit, report feeling fatigue, slow heart rate, which is the most appropriate nursing intervention. Now, whenever they ask you the priority, most appropriate, or then you need to look into more closely because they may have more than one correct statement, but what's the best one? You never reassure the patient the fatigue, bradycardia, normal side. No, no, no. And should not instruct the patient to stop taking the medications. No, no, no. So the correct answer is C, educate the patient to monitor their heart rate. And if it drops too much below 50, well, then they need to report. And it's never advised. That's the worst thing to do, that take it whenever they want to. No, it should be taken consistently, daily basis. It's a known impact of the drug, metoprolol, beta blocker. It is going to reduce the heart rate, but you just need to make sure it doesn't drop too much. Okay. excuse me. Patient has hypertension, given beta blocker, ending in LOL. Which of this classified as beta blocker? Easy. Nice. Yes. B, any drug ending in LOL, beta blocker. And anytime you give your hypertension medication, look for the orders. In orders, usually, there are instructions that hold the dose if the blood pressure is below so and so. They will have a number there. The doctor orders usually that way, that if it's below this number, hold the dose. So anytime you're giving them these medications, hypertension, the first thing is to assess the patient, right? Add by. Assessment is the first thing. How would you know that is it okay to give it medication or should I hold it? You will only have the answer
Check the blood pressure.
when you check the blood pressure. So that's the first thing. Check the blood pressure, and before you give the medication, go to the order. Go to the order, see what it tells you. And I have seen this pretty much everywhere now, that these software, so it's entered in there and it pops up. So you need to enter the blood pressure value you just took, and then you have to initial and then hit enter or OK. Then only you're allowed to give the medication. So never give the medication first and then enter it. Never. Excuse me. Okay, patient old, 65 year, has a history of asthma, given propranolol for hypertension. Which of the following concerns should the nurse prioritize when educating the patient about this medication? Brilliant, excellent, guys. Proud of you. Well done. I see majority of you answering correctly. Good job. Now, as I always say, guys, don't try to memorize everything for every single drug. Okay, ask yourself what is important in this drug and focus on that. For example, beta blocker, are you able to identify by name? Well, look for LOL. You can identify. Then how do they work? They block beta receptors, beta blockers. They block beta receptors. Where are they? There are two types, right? Beta 1, beta 2. Beta 1, and you heard, beta 2, lungs, right? Specific and non-specific. So if they are non-specific, then the risk is much higher for bronchospasm. We are giving this medication to control their blood pressure, right? Hypertension. But non-specific beta blockers are going to go on a walk to the lungs, and instead of helping out, they will create a problem. They will cause bronchospasm constriction. So now they will have poor air exchange, gas exchange, and the patient who has asthma, COPD, that's a respiratory condition. And now you're decreasing the supply of amount of oxygen there. Well, they will be in trouble. So you have to be very careful. Another thing, if the patient is diabetic, make sure that you monitor their blood glucose as well. In patients that reports, cases, then you can do that as well. Not a high concern as of asthma, COPD, but they still, you should be watching for that. Okay, one more thing. That's also equally important. These beta blockers, especially your patients who are diabetic. Now, what is the problem in diabetes? Too much blood glucose, right? Too much blood glucose. Now, if that's the problem, how do you fix it? You give the medication to bring the blood glucose down, correct? Now, every patient is different. The same dose, same drug, acts differently on different patients, right? Now, one patient may have, like, their weight might be more, like 180, 200 pounds. The other might be just 100 pounds. So it is going to impact differently both patients. You have to be careful, based on that particular patient. And if the patient is diabetic, well, they are taking diabetes medication. One of the biggest concern when somebody is taking diabetes medication is hypoglycemia, right? Low blood glucose, because that's the property of the medication they're taking. They're going to bring the blood glucose down. And what is the concern with beta blocker? They mask the signs and symptom patient presents when their blood glucose is low, like sweaty, shaky, hunger, that kind of stuff. So it can mask many of the symptoms, and neither you or the patient may realize that the blood glucose is going low. So that is an important aspect. And if the patient is diabetic, if they're taking these medication, you should monitor their blood glucose more frequently. Does that make sense? Relate these things, how it's going to impact your patient. That's what exactly is important. That's what they're going to test you. Next, patient intensive care unit given epi-nor-epi for septic shock. In septic shock, well, shock is like you get still. Still means your blood pressure drops, your heart is not beating, right? So you need to now pace up the heart. And how do you pace up the heart? Causing vasoconstriction, right? Vasoconstriction. So this is what these epi does. So C is the correct choices. Increasing the blood pressure by stimulating the adrenergic receptor, which causes vasoconstriction. Anything causing vasodilation, the blood pressure is going to go down. Any drug which causes vasoconstriction will increase the blood pressure. So these drugs are given when the blood pressure is dropped. And that's what exactly happens when patient is going into shock, through shock. Any question? But is okay? All right. Next question. Patient with septic shock receiving nor-epi via IV infusion. Which of the following is the priority nursing action while the patient is on this medication? Excuse me. Correct one is A. You need to monitor the blood pressure closely. Every 2-3 minutes until stable, and then every 5 to 15 minutes. Okay, let's move on. Nurse reviewing a patient's medication list and notes the prescription for valproic acid. Nurse understand the valproic acid is classified as which type of medication? What it's used for? Is it a psychosis drug, antipsychotic, anticonvulsant, antidepressant, anticholinergic? So if you get kind of a little confused and find hard to know which one it is, try to start kind of crossing out which are you sure about. Like, for example, option D, anticholinergic. You know that. And a good example for anticholinergic is Benadryl. And you never heard about valproic acid falling in the same class of Benadryl? No. Well, then cross it out. Antidepressant. So depression drugs are like SSRIs, SNRIs, TCAs. Valproic acid is not in that. So cross it out, right? So similarly, any other question, either start crossing out the correct ones or the incorrect ones, whichever you're sure about, and that will narrow down to the correct choice. So this is B, anticonvulsant. It's used for seizures. Okay. Now you're teaching a patient about adverse effect of valproic acid. Which statement of the patient indicates the need for further teaching? So you, once again, you're looking for incorrect option here. Okay. So D is the correct choice. It's normal for my heart to occasionally skip a beat while taking this medication. No, no, no. That's never normal, skipping a heartbeat. Okay. Perfect, perfect. Good job, guys. Now, let's see if we know the therapeutic values of phenytoin. Why we're putting it? Because it's a narrowtherapeutic index drug, and also because it can become toxic real quick. We need to make sure we keep our patients safe, so we need to know the normal values. Excuse me. Okay, come on, everyone. Try to answer the question. All right. Yes, B is the correct choice. Okay. 10 to 20. 10 to 20. So if the range comes below 10, then the patient will be at risk of seizures. But if it's higher than 20, that's when the patient is at risk of toxicity, can experience signs and symptoms of toxicity. Okay. If you're giving phenytoin as an IV, what can you mix it with? Okay. Excuse me. Okay, majority of you answered correctly. C is the correct choice here. And on NCLEX, if you're tested on this concept, where they're asking you, like, what can you mix it with? And if you don't know, go with normal saline. Most of the time, that is the correct choice. Okay. Because if you mix phenytoin with any other of them, it will precipitate and it will clog the line. So only with normal saline. Okay. Now, what are the examples of the old generation one? First generation, typical antipsychotic drugs. So typical are old one, atypical are new ones. General criteria, typical old one have more unwanted adverse effects. The newer one are more specific, targeted with less adverse effects. Okay, perfect. Yes. A is the correct choice here. Your haldol, haloperidol, chlorpromazine, fluphenazine. These are old generation or first generation, or in other words, called typical antipsychotic medication, and they are not that commonly used because have severe adverse effects associated with them. Okay. All right. Now, the patient's given atypical antipsychotic. Atypical means the newer ones. Which of the following combination includes examples of atypical antipsychotic drug? Nice. Yes, you are absolutely correct. A is the correct choice. Your clozapine, risperidone, which is Risperdal, olanzapine, Zyprexa, those are your atypical, the newer generation, the second generation antipsychotics. Okay, perfect. Now, you as a nurse caring for a patient who's been prescribed haloperidol, that is older generation, first generation, typical antipsychotic. For schizophrenia, the nurse should closely monitor the patient for which adverse effect? And that gives you an idea like why they are not used commonly anymore. Excuse me, guys. Okay. Yes, everybody answered correctly. B. EPS or extrapyramidal symptoms, unwanted gifts. Okay. We don't want that. Extrapyramidal symptoms and tardive dyskinesia. That's a movement disorder. Okay. And because of this, they're not used commonly anymore. Your tardive dyskinesia is a late onset. It could be even irreversible movement, disorder when your patient, um, you know, is repetitive, causing involuntary movements in them, lip smacking, tongue protrusion. Those are adverse effect falls under that category of your tardive dyskinesia. Okay. Now you're providing discharge teaching to patient who's given antipsychotic medication. Now which statement indicates a need for further teaching? Means we're once again looking for incorrect statement. Now whenever your patient is given antipsychotic medication, means they have a psychotic condition, psychosis, and it is a long-term commitment. You need to make sure patient understand it's a long-term commitment and they should be taking it consistently as prescribed and never abruptly stop them. And knowing this fact will give you the right answer, which is B. If I feel better, I can stop taking the medication. No, 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 no. So B is the right answer. Okay. How about next question? For what condition gabapentin I mean, if it is an anti-epileptic medication, but it's what it's most commonly used for. Excuse me. You're absolutely right. See, neuropathic pain. Can you give me an example? Like in what condition patient usually experience it? Any example?
Neuropathy.
Neuropathy.
Neuropathy in what condition?
Diabetes
with
patient.
yeah, very common with diabetes. Uncontrolled diabetes over a period of time, the nerves get damaged and they develop neuropathic pain. And your usual pain medications, they don't help because it's a neuropathic pain and you need a neuro medication. And that's when these drugs comes. Gabapentin, right? And then amitriptyline, Lyrica. These are the drugs. They do not belong to that particular indication, but they're very commonly used for that indication.
I do have a question about gabapentin. I did see some doctor prescribe for some of my patients not able to sleep at night. Would that help? Because I'm
Yeah,
always know it for diabetes, for neuropathy, but it's kind of strange for me to teach patient for sleeping, like
uh,
sleeping day and night.
so it was the patient diabetic or no?
You see, yes, she is diabetes.
Okay, so now it could be multiple reason. Number one, if the patient has diabetes from a long time, as I said, the nerves get damaged, and usually, when they're ready to sleep, nighttime, their lower leg starts hurting really bad. Okay, it can happen during the day as well, but nighttime more specific. They go through pain, can't sleep. Also, this makes your patient drowsy, sleepy. So it helps both ways, helping in the pain as well as in getting to them to bed, so they can sleep well. Does it make sense? There are many drugs which are used non-traditionally for non-FDA indications. Like same with your lyric as well. Same thing. Another example like amitriptyline, very commonly used for like patients who has a sensitive tummy, right? The tummy gets triggered very easily, like with stress and all that. Your tummy is a second brain, and that's when you're slowing down the tummy so that it doesn't get bothered with those things. Like, people develop those irritable bowel syndromes, So it can be used there as well, but it's a non-FDA indication. Next, educating a patient about seizure medication. What advice should the nurse provide regarding the medication? Because this is a common reason the patient fall back. They start feeling better, but they are not consistent, especially homeless people. So they start experiencing the problem again because either they don't go see the doctor, or they don't go pick up prescription, or they take bring it to them, but they don't take it or abruptly stop. And that's exactly we need to teach the patient. Option C, that do not abruptly stopping the medication, because hey, we're giving this medication for a reason, to prevent seizures. And patient is having seizure, we are giving medication to prevent. Now, the medication which was going to prevent the seizure is not there. Well, what is present there? Seizures. So now they will have seizures again. So that is the reason, never skip a dose and never abruptly stop the medication. Okay, any questions so far, guys? Anything? All good? Okay. Ready? Now, patient given MAOI, monoamine oxidase inhibitor for depression. Now, what you should be telling them to avoid, because there's a severe problem can pop up, hypertensive crisis. If that happens, patient most likely gonna end up in the emergency department. So it's an important point. You should know anytime your patient is on MAOI, it is real important to prevent option B, ace cheese, red wine. Why? It contains tyramine, right? Tyramine. It's a naturally occurring amino acid in those foods. So when somebody consume those tyramine-rich food while taking MAOI, it can rapidly increase their blood pressure, causing hypertensive crisis. Okay. You're educating patient. Once again, MOI, avoiding tyramine food to prevent hypertensive crisis. Which foods? We talked about a couple earlier. Let's add more. And collect sometime they will just say like, tyramine containing food. Sometimes they throw the names of food and you need to identify which ones. So here the correct choice is A. Aged cheese, salami, soy sauce, red wine. Those are the foods to avoid. Pepperoni, that kind of stuff. Aged cheese, that's a cheddar, blue cheese. Then cured meats, salami, pepperoni. Fermented products, which is like soy sauce, sauerkraut. Then alcoholic beverages, either beer, red wine. These are real important to avoid. What are the examples of MUIs? We did that previously as well. I think there's one different name there. Yes, B is the correct choice. Phenelzine, tranylcypromine, acecarboxylate. Those are your MAOIs. Okay. You're educating a patient who has bipolar disorder about use of lithium. Which statement the patient indicates the need for further teaching? Once again, incorrect choice. Okay, good job, guys. Good job. C is the correct choice. If they feel thirsty or they're urinating, well, tell them to stay hydrated. There's no need to stop taking the medication. Because if they stop the medication, well, they will face the problem what we're trying to prevent, the bipolar disorder. Right? Now, lithium is also a narrow therapeutic index drug. So we need to know the value, normal levels. Good job. Yes. B is the correct choice, guys. 0.6 to 1.2. So if somebody has level below 0.6, well, they'll be risk of the bipolar disorder. But if the levels are above 1.2, the risk of toxicity. Mild symptoms could be like nausea, vomiting, but it could become real severe where patient can experience seizures, coma, that kind of stuff. Excuse me. Okay. You're assessing a patient who's on lithium for bipolar. Which symptoms are indicative of lithium toxicity? Because if we know it has a narrow therapeutic index, it should be between 0.6 to 1.2. But hey, what are you looking for here? Signs and symptoms of toxicity so that you can catch it at an earlier point. Good job. Yes. C, nausea, vomiting, and tremors. That is what the signs and symptoms of lithium toxicity. Okay. Next question is also about lithium. Who's taking it for bipolar disorder? That what increase the risk of lithium toxicity? Because it's important. We know it's a high risk drug, narrow therapeutic index. Well, what is important to know? And always look into both aspects, like, if anything can lower the drug or can increase the drug. Okay. Now, the correct choice here is C. Okay, using a direct medication. Why? Lithium gets excreted through the kidneys. Okay, and we know it's a narrow therapeutic index drug. A minor deflection, a change in concentration can change its effect. So anything which alter the kidney function, alter the sodium levels, can significantly impact the lithium levels, which can put your patient at risk of toxicity. Okay. Now, other things are important as well, but that's most important. You should tell your patient to not change the amount of sodium they're consuming. They shouldn't change it because your body can get confused between lithium and sodium. And if they are taking more sodium, it can decrease the amount of lithium in the body, and which can cause the problem. And if they reduce it, the body may hold on to more lithium, can cause toxicity. So they should stay on same diet plan. Okay. And whenever they're taking like a diuretic medication does what? Pushes the fluids out, right? It's going to push the fluid out. Fluid doesn't go out alone. It's going to take sodium as well. Now the sodium going out more means staying less. Low sodium will cause more lithium in the body, can cause toxicity. Multiple angles. Educating the family of a patient who's going to start an anti-epileptic medication. What potential concerns should the nurse emphasize? Now here, it doesn't give you a name of a drug. You're being given a class of medication. So there's no need to pinpoint on liver toxicity or anything, because all anti-epileptic cannot damage the liver. So cross that out. Always, if your patient's starting any antidepressant, if they're taking any anti-epileptic, it has the same concern, risk of suicide during the initial period. Okay, so C is the correct choice here. Okay. Any question, guys? Any question? No? All right. Let's move on to the next one. Oops, sorry. I am sorry. I didn't intend to do that. Here you go. Educating patient family, turning emphasize what. Oh, we did this. Okay, I'm sorry. I just put that on. Here you go. What is the term called when patients have difficulty performing voluntary movements? Is it ataxia, dysphagia, dysarthria, dyskinesia? Now they're quite close, so we need to know the difference between them. So let me go over that. Option A, ataxia, which is the correct choice as well. This is the loss of full control of body movements. Okay, read it. Difficulty performing voluntary movements. They are not able to control. And that's what exactly ataxia is, loss of full control of body movements, resulting in difficulty coordinating the voluntary movements. It can affect different body parts, lead to unsteady gait, clumsiness, difficulty with fine motor skills. As far as B, dysphagia, this is difficulty swallowing. Difficulty swallowing. It's not related. C, dysarthria. This is difficulty speaking. Difficulty speaking. So it's a speech issue, not related. Dyskinesia, even though it's a movement disorder, that's different. Means abnormal, involuntary, okay, not voluntary, involuntary movements rather than difficulty with voluntary. That's the difference. So may kind of mix things up between or confuse between A and D. So A is with the voluntary, D is with the involuntary movements. Okay, is that clear? The difference between A and D? Yes, A is the correct choice. Because
So
the question is about voluntary movements.
then it should be completely no movement at all, but they're saying difficulty performing. So
It
that's why
it 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 could be a different level. It could be a different level, patient to patient. It can't just completely block for everyone. A different level of severity, but dyskinesia is a involuntary movement. It's not a voluntary movement. That's the basic difference. Because the question asking you performing voluntary movements. Do you understand what I'm saying?
So would it be safe to say for ataxia is no control of voluntary movement, and for dyskinesia, it's abnormal involuntary movement?
Involuntary, that is 100% correct. And this level of severity could differentiate in both, like, that to what extent. But ataxia with the voluntary movements and dyskinesia problem with performing involuntary movements.
So by involuntary movement, you mean some GI movement or something like that, like movement inside the organs?
Could be, or like
Peristalsis, let's say,
or maybe they are doing like some repetitive movements, that kind of stuff. Usually it's associated with like neurological disorders.
Okay.
Excuse me. Okay. Patient has a history of schizophrenia, been on long-term antipsychotic medication therapy. Now, the patient presents with involuntary movements of the tongue, lips, face. Which of the following actions should the nurse prioritize? Like, what could be the potential issue? Remember the previous one? Voluntary, involuntary. Something happening. They're not doing it. It's happening on. Yes. Excellent, guys. Proud of you guys. Yes. Brilliant. B. Notify the healthcare provider to evaluate tardive dyskinesia. Remember option D in the previous one? Involuntary. Right? Involuntary. Okay. We don't want to increase the patient dose. No, 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 no. Notify the healthcare is the best thing. Administer benzodiazepine while you can do that. You need somebody to do their job first. Encourage the patient to participate in relaxation therapy. We all know it's involuntary. They're not going to be able to control it. So the best thing is call the DOC, right? DOC TOR. Let them handle it. Whatever the order you get, that's when you step in. Okay. We're educating a patient who's newly diagnosed with Parkinson's about the medication. Which of the following medication considered the first line treatment of Parkinson's disease? You know, you may come across many medication, but hey, what is the drug of choice? We talked about it earlier. Nice. Good job. Yes. Perfect, guys. I am proud of you guys. Yes, carbidopa, levodopa. That is a combination. Okay. Cinemet is the combination drug in one pill, carbidopa, levodopa, both. But you may come across medications formulation when carbidopa is one tablet, levodopa is in addition different one. So maybe they're taking two pills. It depends on convenience, what the people preferences are. They don't want to take too many pills. Well, then they may take this combination, but then insurance says, hey, it's expensive, we don't want to pay that much, that kind of stuff. So those many things determine what they will be taking. It'll be the same effect, but the choice of drug is this, that either together or individually taken together, carbidopa, levodopa, that's the drug of choice. Because in this, what is the imbalance between dopamine and acetylcholine? Dopamine is low, and carbidopa, levodopa given together, that gets converted into dopamine and fulfill that gap, whatever they're deficient in. Okay. All other are different. Propranolol, Requip, it's a dopamine agonist. Okay. Then can be given, but hey, that's not a choice. Benztropine, it's an anticholinergic. It doesn't directly help in the Parkinson disease, but hey, it is used for managing the tremors in these patients. Okay, and solagelin, that's an MAOI. Next, educating a patient newly diagnosed with Alzheimer's. Caregiver but is there. You're talking about donepezil, Aricept. Which statement by the caregiver indicates a need for further teaching? Means they don't understand clearly, so look for the wrong statement. Well done. Okay. This is a progressive disease. You cannot reverse it. You can only slow the progression. You cannot cure it. So you never tell your patient that this medication will cure the disease. That's never going to happen. So A is the correct choice. You need to tell them the facts that will slow the progression. Your symptoms will be reduced, but it's not going to cure. Okay. All right, next. Nurse educating a patient with Parkinson about the newly prescribed medication regimen of carbidopa-levodopa, the nurse explained that carbidopa is included in the combination therapy. For which reason? We know that dopamine is less. We also know levodopa gets converted into dopamine. Well, if that's enough, why are we giving carbidopa? What is the purpose of carbidopa? Okay, all right. Majority of you answered correctly. There are few incorrect choices there. The correct choice is B. Because we want enough levodopa reaches the brain, it gets converted into dopamine. So we want more dopamine here. Okay, carbidopa helps preserve levodopa. So the more levodopa reaches the brain, gets converted into dopamine. That's what we need. If that doesn't happen, you may need a much higher dose of levodopa to produce enough dopamine, which can put your patient at risk of toxicity as well, too much of the dose. So you are sending carbidopa to keep levodopa safe until it reaches across the brain barrier, right? So it inhibits an enzyme, dopa decarboxylase. That enzyme converts levodopa to dopamine in the periphery, which is outside the central nervous system. But we need more dopamine in the brain. So it helps reaching more dopamine there, preventing the breakdown of levodopa before it reaches the target site. Okay, everybody understood the point? Everybody clear? Why we're giving carbidopa?
To save the levodopa.
Okay, here you go. Next one. You're educating a patient about adverse effects of tolcapone. Okay, it's a COMT inhibitor, COMT, catechol-orthomethyltransferase inhibitor. That's an enzyme. It's an enzyme. So these drugs, for example, the tolcapone, entacapone, they inhibit that enzyme. What is a big concern with these medications? First of all, do you know what this medication given for? Anybody knows? Okay, no worries. This medication used for Parkinson's disease. Okay, Parkinson's disease. Now, I want you to remember this thing. There are two drugs, okay? Tol cap on, Antec on. They have a cap on. Remember that. Alzheimer drug, which has a cap on at the end. If you read Tol cap on, the other one that starts with ENT, Antec cap on. So if you see that in the name, that's for Alzheimer. And always worry about the liver. They are hepatotoxic. So if you come across a drug which has a cap on, either entacapone, tolcapone, worry about hepatotoxicity, liver disease. What are the signs and symptoms of hepatotoxicity, liver damage?
Jaundice.
Jaundice is the condition, and the signs and symptoms are yellow, yellow, yellow. All secretions become yellow, right? So always monitor the patient. And if your patient does not have a healthy liver, do not give it to them, right? Because we know the gentleman who has a cap on can damage the liver. Understood? Clear? Remember this point now. NCLEX want to make sure you keep your patient safe, and they say please do not hurt your patient. And remember here, the gentleman comes with a cap on. If you're not able to monitor, or if you're not able to prevent, who does not have a healthy liver, and you let them take it while you're hurting them, you are not able to prevent that injury. You're causing an injury. That's what NCLEX want to assess. Learn to think how NCLEX wants you to think. Okay, keeping those concepts in mind. They're not worried about nausea, vomiting. What's going to happen with nausea, vomiting? They'll throw up. Well, then what? But hey, liver, problem, right? I think I did share with you guys, right? The list of drugs with has adverse effect associated, like, which are hepatotoxic or affect the hearing and vision, that with you, right? In the beginning. I did share those lists, I believe so. So please have those lists with you. Always keep them with you. Look through that, create a mnemonic for all those, like one mnemonic for drugs which are hepatotoxic, the drugs which are can cause toxicity to your kidneys or vision. Create mnemonic for each, and 5-6 mnemonic will help you to each and every single question comes on that point to answer it correctly. It's not possible to just randomly memorize that. Whenever it comes and you memorize it, it's not gonna stay in your mind. Which one was it? It'll get mixed up. Create mnemonic, write it a few times, we'll do well.
Where was the list shared on?
Guys, do you guys remember? Was it in an announcement, or did I send
I think it was in the
a Canvas
announcement.
message?
It was in the announcement in the beginning.
Okay, I'll look. Thank you.
Yeah, please look to that. If you can find, if any one of you can share, if nobody can find, let me know, then I will share it again. Okay. Those will help you, not just now, like in your career, to keep your patient safe. Okay.
I have a question.
Yes, me.
I'm having hard time remembering the meds I'm sorry, but it's just too much. Like,
It
what's
is.
the key way to
Okay.
remember?
So what is the difficulty? You don't need to remember every drug and not everything about drug. What's the problem? What is the challenge? Like, what cannot you remember, or are they mixing up?
They're mixing up, I think. I get confused.
Get confused. Okay. That's why I'm saying create mnemonics. Okay. Learn what that drug is used for and how it fixes the problem. Like, what is the mechanism of action? Now, for example, we are working here, like we're looking at this carbidopa levodopa, right? So in order to know about this, understand this condition, you need to know, like, what the problem in the body. Well, given for that disease, when there is an imbalance between dopamine and acetylcholine, then the next question is, okay, which one is more, which is less? Dopamine is less, acetylcholine is more. And that will answer you that how does this drug affect? When you give them this drug, it will fulfill the deficient part, dopamine, in the brain. That's the mechanism of action. It will increase the dopamine levels, right? Now, in order to know, understand, remember what other concerns I should be aware about this medication. Now, what's going to happen? They were deficient in dopamine. What are the signs and symptoms of Parkinson's disease? Know that. Now, if you give the drug higher or it reaches the toxicity level, well, now they have too much dopamine. Know the signs and symptoms of too much dopamine, which will be completely opposite to what the problem sign and symptoms are. They didn't have enough. Those signs and symptoms will go the opposite end when you gave them too much. Those are the signs and symptoms of toxicity. That's what you should be aware of. Next thing would be, hey, is there any antidote for any medication? Not all medications have antidote, only some. So if they're important, for example, high-risk medication like warfarin, patient can bleed to death, right? You need to know. Or any drug which is neurotherapeutic, know for that. Then, as I said, do not try to memorize every single thing about every single drug. Ask yourself, what are the biggest concerns? Like on the previous slide, remember I told you about toll cap on? I didn't tell you to remember anything else, right? All I said, remember liver issue. That's what important. That's what they're going to ask you. Forget about the cluster, all other clutter. Does it make sense? You need to learn how to separate important information from extra stuff attached to it. You don't want to carry the extra burden on your shoulders. Okay, that should be the first thing. What to focus on. Another good example. You're talking about Tylenol, you're talking about ibuprofen, right? They may throw a case, the patient has unhealthy liver, okay? In another scenario, they may throw up the patient has cardiac condition or risk of GI bleed, okay? Well, how do you know what is important? If the patient is taking Tylenol, the concern is liver because toxicity can damage patient's liver. Is that concern with Motrin? No. What is the concern? GI bleed, right? So just know what is important about that particular drug. Usually what students try to do is try to know every drug's each section. Oh, their use, okay, their adverse effects, side effects, interactions, this and that, and this and that. Don't do that. Okay, pinpoint what is big concern relevant to this drug, right?
Okay. Thank you.
If your patient is taking warfarin, the biggest concern is what? Bleeding. Who cares about nausea, vomiting, and that, right? Save your patient, right? Do you agree?
Yes, thank you.
Focus on those points. That's what you exactly you're gonna see, like in NCLEX. They again, same concept. Can you keep your patients safe and do not hurt them? Because if you're not able to filter these things, you're gonna hurt your patient. Okay. And try to kind of put drugs in categories. For example, if you try to memorize, oh, how does Benadryl work? And what are the adverse effects of Benadryl? Then you say, okay, now I'm going to read about cetirizine. Now, excuse me, now I'm going to pick up another one from that class. Don't do that. All anticholinergic, their mechanism of action is same. They are anticholinergic. They block the cholinergic receptors. So when too much acetylcholine, the patient's secretions are more. Okay, anticholinergic, decrease the secretion is going to make your patient slow, sleepy, drowsy, dry, like Benadryl, right? So all of them, the concern is same. The patient is going to be slow, sleepy, drowsy, dry. So when you're slow, sleepy, drowsy, dry, well, you don't take anything else which is going to make you more slow, sleepy, drowsy, dry. That's a safety risk. Do not drive. Do not take with alcohol, opiates, all things, because you're going to be more slow, sleepy, drowsy, dry. Correct? So know what the problem is, and that class, all the drugs under that, they're pretty much going to do the same thing, and just group them together under that. You don't have to individually memorize everything for every single drug. Okay?
Thank you, Professor.
You're welcome. Okay. Nurse preparing to administer atropine to patient who is experiencing symptomatic bradycardia. Bradycardia is what?
Slow heartbeat.
Slow, yes. So we know atropine will pace up the heart. So which of the following actions demonstrate proper nursing understanding of the medication effect? What's going to do and how to, because some of the drug, they have to be given in certain way or mixed with certain agents. So there's some criteria to know. For example, remember a few slides ago, we talked about phenytoin, which can only be mixed with normal saline, because if you mix with anything else, it will precipitate. If it precipitate, well, it's gonna block the line, right? In this case, important about that is atropine should be given as an IV push, not an infusion. Okay, so it's an IV push. A is the correct choice, that it should be rapidly given as an IV push. Because the patient has bradycardia, you need to pace it up. Okay, it's an anticholinergic medication. So anybody has symptomatic bradycardia, it blocks the parasympathetic effect of the vagus nerve on the heart. So increase the heart rate. Because if you give it slow infusion, it's not going to be effective. It's not going to be effective. Okay. Okay. Now, we know atropine, why do you give it? Well, then what should you monitor? A very important thing to remember here is it's an anticholinergic medication. Inhibit the parasympathetic nervous system because blocks the acetylcholine, right? Now, it is what? Anticholinergic medication, right? Anticholinergic makes you slow, sleepy, drowsy, dry. When it makes you dry, cannot increase the salivation. That's a secretion. Wrong, right? Bradycardia. Why we are giving it? The patient who has bradycardia, right? So it is going to pace up, not slow down. Wrong. Okay. Option D, diarrhea. It's an anticholinergic. Anticholinergic makes you what? Slow, sleepy, drowsy, dry. When they experience diarrhea, means making wet. More stools, right? But they cause dryness, means constipation, not diarrhea. Make sense? Just remembering that concept, it makes you slow, sleepy, drowsy, dry, will give you the right answer of blurry vision. It can cause blurry vision. That's important. It will cause dryness in the mouth, can increase the urinary retention, can cause constipation. Those are the important points to know about this. All clear? Okay. You're administering dopamine to patient in intensive care unit who's experiencing cardiogenic shock. It's a cardiac shock. What is a shock? Like that, okay? You stopped somewhere. Frozen. When your heart is frozen means it's not beating. That's a shock, cardiogenic shock. You need to pace up. We know that that's what dopamine is going to do. It's going to pace up the heart, correct? Which of the following assessment indicates the medication is achieving the desired effect? So decrease heart rate. The patient, his heart rate is low or not beating. Do we want to decrease it? No, right? We want to pace up. Wrong. Warm, flushy skin. Are we worried about that? Oh, the patient is dying. Who cares about that? Decreased blood pressure. Are we trying to decrease or increase? We're trying to increase, right? So what is left? A, increase urine output. Reason, heart is what? A pump, right? It pumps the volume, correct? Fluid. When patient is going to urinate? When the volume moves on, right? Fluid moves on. They're not going to be able to urinate if heart is not working, correct? So if the urine output is increased, well, it's doing well. Make sense? Sometimes these answers are tricky. Know the concept. What are they doing? Heart is a pump. Pump does what? Pump the fluid. Fluid is the volume, either in or out. Going out is in form of urine, and that will increase the urine output. That's simple. Okay. All right, next one. What is a serious adverse effect of dopamine? Now, let me give you a hint. Serious adverse effect usually are associated with the same system you're trying to fix. Now, what are we trying to fix here? Heart, correct? Heart is not beating. Now, related to what?
Output.
No, not decrease urine output here. I'm talking about the same system, heart. Okay, heart does what? Heart beats, right? Heart beats. So it is going to affect the heart rhythm. You're pacing it up, right? You're pacing up the heart with this drug. The biggest risk would be irregularity in the heart rhythm, either a little slow or fast. That is the biggest concern here. We're worried about the output or anything, warm, flush skin. No, I'm not worried about that. Okay, I'm worried about the heart rhythm. Also, respiratory rate. Now, why that's important? Dopamine is a vasopressor. Pressure will increase the pressure. Pressure will increase the cardiac output. Increased cardiac output will increase the blood pressure, right? But the serious adverse effect, because it's all happening, we are pacing up the heart. We are increasing the rhythm like heart rate. And that's what we should be focusing on. The patient should be on a heart monitor. Okay? Any question? Any or many? Everybody still awake? Yeah, or trying to be awake?
Yes.
Struggling? All right. Let's push a little bit more, okay? Not too many left, only a few. Okay. You're educating parents of a child who's given an ADHD drug, methylphenidate, okay? Which statement by the patient indicates the need for further teaching? Means we are looking for, once again, which statement? Right or incorrect? Correct or incorrect? Incorrect, right? And absolutely right. Now, just let me give you a little bit more better understanding about these. The A statement A, I'll give the medication to my child in the morning to avoid insomnia. That is 100% right. If you give this medication later, they won't be able to sleep. So that is the reason you give it in the morning. I will limit my child's caffeine intake while they're on this medication. Well, it can impact. That's not the highest importance here. I can stop the medication abruptly. Whenever you see in any option, stopping the medication abruptly, I would say majority of the time, that is your correct answer. Okay, you never abruptly stop any medication at all, no matter what. I'll monitor my child's appetite and wait while they are taking this medication. The reason, it may suppress their appetite. And If that happens, they're not going to eat enough. If they're not going to eat enough, they may lose weight. And also their growth might be slow as well. So that is the reason you monitor that. Okay. Okay. Next. Now you, as super nurse, is educating a patient newly given SSRI, selective serotonin reuptake inhibitor for depression. Which statement by the family indicates need for further teaching? Once again, look for incorrect option. Perfect. Good job, guys. Yes. Once again, stopping medication abruptly, immediately, as soon as you feel better. Ooh, never, 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 and never. Right? Good job.
I really wish all the question would be like this.
Not all, but see, if we understand the concepts, like this is one concept, right? So similarly, we understand those concepts, then any type of question, you just evaluate on that particular concept, like, okay, where does it stand? And you'll get the answer. Okay. You're educating patients diagnosed with depression about SSRI, selective serotonin reuptake inhibitor. Which of the following is an example of SSRI? Can you find out which is an SSRI, selective serotonin reuptake inhibitor? So these drugs will increase the level of serotonin in brain so that they can feel good. Remember, depressed person don't feel good, right? They don't want to talk to anybody. They don't want to eat. They don't want to socialize, that kind of stuff, because serotonin level is low. You want it to increase by using these drugs. And if you give it too much, the biggest concern would be serotonin syndrome, means too much of serotonin. That's also not good. So here A is the correct choice, sertraline. Your amitriptyline, that's a TCA, tricyclic antidepressant. Your duloxetine is in the same class of your gabapentin. These are your SNRIs, okay? And bupropion is a norepinephrine dopamine reuptake inhibitor. There's another form, Chantix, that's used for smoking cessation as well. Okay, you are educating patient on SSRI for depression. Which statement indicates the patient understand the potential adverse effect of this medication? Now we're looking for the correct statement here. Now, if you look at it, B, I should stop the medication if I experience nausea. No, no, no. If I miss a dose, I should take 2 doses. No, you should not skip. You should never double dose. Incorrect. I don't need to worry about side effects because they usually don't happen. Oh, nobody knows that. So only one left is A, that in the beginning, because every drug to every different individual will act differently. So until they're not comfortable, like how it's going to impact them, they have to be careful in the first few weeks to avoid operating heavy machinery because it can slow down their response and all that. So you have to be careful. Sedation, fatigue, that's no. Excuse me. Nurse providing education to a patient has been prescribed SSRI. Which statement by the patient indicates need for further teaching? If somebody taking SSRI, having a decreased libido, sexual desire is common. That can happen. So that's fine. But here, if I have sexual dysfunction, it will resolve immediately after stop the medication. That's not going to happen. Not immediately. Okay, so B is the correct choice here. Next, educating about anticholinergic medication. Recall Benadryl, anticholinergic Benadryl, right? Slow, sleepy, drowsy, dry. Which of the following option includes example of medication with anticholinergic effect? Absolutely right. Good job, guys. A, Benadryl, diphenhydramine, atropine, scopolamine, which is transderm scope, a patch, which goes right behind the ear. It's used for motion sickness. It's good for 3 days. Okay. Ipratropium. It's the same with the tiotropium. It comes inhalation form. Okay. Alrighty. Next. Nurse educating patient about potential anticholinergic side effect. Once again, call Benadryl for help you out. What are the signs and symptoms? Easy peasy. What does it do? Make you slow, sleepy, drowsy, dry, and then look for the options. And it is A. Correct. Good job. Dry
Professor,
mouth, blurred vision. Yes.
is there any drug that does the opposite? Like, do we have to watch out for anything that does the opposite of this?
Yeah. For example, your ADHD drug. Keep them awake. Fluoxetine, Prozac, that's also given in the morning. Usually, like, your depression medication, they usually cause some sort of sedation, drowsiness, right? But Prozac, fluoxetine is given in the morning because that can cause insomnia. Yeah.
But like, I mean, the side effects, dry. You know how you said dry, blurred vision, all that
Oh,
stuff. Does anything cause the like? Do we need to look
yeah.
out for something that causes the opposite?
Okay. Remember, we discussed about, there was a question about a drug called botanical today. Botanical increases the secretions, and one of the uses when to increase the urine output, but it can increase this other secretions as well. Botanical.
Okay.
Okay. Now, I think that's it for today. And I believe majority of you were present, in our previous session, right? So you guys have video for the previous session. You want to watch it again, just to go over, like, what are the questions we covered that day. So you just kind of have that combined approach, okay? Right? And I'm gonna upload this video either late tonight or tomorrow morning. You should be able to see that in the YouTube, okay?
So exam will be for module 2 and 3 information.
So let me tell you exactly. Just close this out. Oops. And also, please make sure this time, about the announcement, which I sent after your first exam, that go light. Okay, no electronic devices, caps, your smartwatches, phones. Please don't take too much stuff there, because they mention, like, they don't have too much space. They have very limited space, and it becomes hard there. So please go light, okay? Not too heavy jackets. If you need to, just wear something really light. Okay, so let me open this up here. Okay. Oops. So module 2 and 3, okay? Module 2 and 3, that's what your exam is based on. Now, how many questions were in your first exam? 25, right?
25.
25.
But now you have 50, okay? So please remember that. It's not 25 anymore, it's 50 questions. And you will get 90 minutes to complete that, okay? So go prepared. And as I said, like, please don't take too much stuff with you, okay? Your exam is on Friday, right? On 10? What time is it?
At 10.
At 10?
It starts at 10, yeah.
Okay, 10. Perfect.
10 a.m.
Okay. Do you guys have any other question concern anything else?
Professor, will have any math questions in this exam?
I have to look. I'm not 100% sure. Very minimal if you do. Okay.
Thank you.
Very minimal if you do. I don't think so. Let me try to think. Give me a sec. Where'd it go? Here. Yeah, I am sorry. I'm not 100% sure, but you may not have calculation questions, but if you do, it'll be very minimal, only if there are any. If you see come across, and not going to be many questions if there are. Okay. So please, if you have your notes or study guides, go through, as I said, like what is important. Watch today's lecture and the previous lecture. Let me see. I think you guys are typing something. Where can we view last Zoom meeting? It's on. It's not Zoom. It was on Team, and it's on YouTube. Okay, I shared a link with you guys previously. It's the same link. It will take you there, and you will see that video there. Okay. Do you guys have access to the link? Right, the previous link is the same link. No. I just saw that if we're able to see the results as soon as you're done. I'm sorry, this is how it's set up on Canvas, that it doesn't the results doesn't pop up. It has to be manually done. So that is the reason that you're not able to see the results right away.
Professor, from the medication list that you sent, I did see it. But for modules 2 and 3, what medications would you say are the most important for us to know?
Okay,
There's many.
so I'm sorry, what was that?
Because there are as many. Maybe top 3.
Watch, once again, let me give you a general idea and then focus idea.
Understand about the classification and how to set them up in, like, we can say groups, right? But
Yeah.
from those groups, from your point of view, that is my question is, which, like, maybe the top 3 medications that we should actually really know.
So 2 things, as I said, like one is generalized view, that
Yes.
no matter what you're studying, look for what is important. Okay, which drugs are important? Do they have high risk of toxicity, or they're used very commonly? Because that's what you're going to experience in practice, right? And to kind of refine it more, I would say watch today's video. Okay, watch previous video, watch both, work on the drugs we discussed on GC and the questions and all that. Focus more on them as well. Make sense?
Yeah.
That approach will help you to do well in the exam. Okay. Any other question, guys? Anything else? As far as your class medication classification cards, you guys are doing very well on those. Just as I always say, ask yourself what is important. Important is either severe issues associated, most common things, is there any interaction? Also, don't rush when you're writing. Write clearly, please. Sometime, I have to, ask you to do it again or write clearly or upload again. Make sure that we're not just taking like a picture from far for like all the cards at once and just upload when I can't even read it, right? So please don't do that. It becomes hard for me to grade them, and then we go back and forth. Can you do it again? You do this way, that way. Please write clearly, and then make sure that each section is addressed. Like, because sometime in rush we forget to kind of write down, cover all the sections. So make sure before you submit, you double check that all the sections are covered, because then you lose points if you don't um, cover all those aspects. Um, Personally, and we had like 2-3 meetings already on this. I was in a meeting today as well. The rubric is kind of not that refined, but it's not gonna be perfect for you guys. They're probably going to work on later for future cohorts. But if you see the partial grading, that's what I come with, that I do not find it fair that if there's like 20 points for many things, and if you miss one thing, two thing, and you know, either if everything is there, you get 20, but if you miss one, then you get 0. It doesn't make any sense. So that is the reason you guys see that, partial grading, that you lost kind of fractions of some grades in there. And actually, that's what I recommended to management as well. And we came across it pretty soon. Everybody's going to follow the partial grading, so that, you guys should get what you deserve. I mean, that's a lot of work. I'm not gonna give 0 to anybody if you missed one thing, and there you should get what you worked for. So that is the reason. I hope you understand that why you get some kind of fractions or partial grades in certain things, that you miss some, but I still want to give you the big chunk. Okay. And one thing, I know it might be, maybe a little inconvenient that you got many notifications changing the dates on due dates, because I wanted to keep you guys ahead of time so that you are done with the everything else before your final exam. And you guys did amazing. And my apologies to you and your families to keep you on there. But trust me, I was there as well. Because as I said the very first day, I have one goal: make you successful. Okay. And I felt pharmacology is not one of those subjects that you can kind of detach yourself for 2 weeks and not feeling overwhelmed when you come off, after the break. So thank you everybody for understanding that and keeping up your pace on that. And please don't stop here. Keep working ahead, and trust me, you will see the amazing positive impact on your final exam. It's a big thing. People get stuck finishing up their assignment and then finding themselves not having enough time prepare for final exam, and then failing with fractions. I don't like that. I don't want you to stress out before the final exam. I want you to have free mind. So keep working ahead, finish them early so that you are comfortable in comfort zone and not stressing out, because stress is the worst enemy. If you're stressed out, even everything, it's going to make a mess in your mind. Okay. And if you need any help at any point on my end, I always say don't ever hesitate. Just let me know. I may not be able to fix everything, but I'll do whatever I can on my end. Okay. So I think, except maybe one or two students, everybody's done with week 4. And a lot of you already submitted week 5. So please keep up the pace, keep working ahead, finish up your week 5. In the next week, pick up 6, even though on calendar it's showing week 4, keep working ahead. Okay. So say sorry from my end to your families that, I know that family time these days is also important, but, I look at as a bigger picture, because the positive impact it's going to make, it's not only you, it's your families too. If you stay on the track, you do well, the positive impact will be around you. Okay. But if we step back a little bit and just that week to week thing, that temporary happiness, if that gives you stress, everybody around you stress, that's not worth it. You'll forget about that, um, how much I bugged you guys, bother you guys, um, but you will remember this, how um, helpful it was. And when you achieve this goal, you'll be happy. Everybody around you will be happy. So that's what I kept in mind. So once again, sorry for keeping you busy, but trust me, it will give you a big reward. Okay.
Well,
So
thank you.
anytime, yeah, you're very welcome. You're very welcome. I knew it's not that you may feel like your Professor Sra is like, even in holidays, still bugging, do this, do that, do that. I know that how you felt. I understand that point, but my goal was like, no, let's keep pushing, let's keep pushing. You know, Hopefully my students will forgive me for that, but I want them to smile uh, at the end of the course. Okay, that's what my reward will be. So keep pushing hard. You all are doing very well. Good job on everything. Just tell yourself you are half done, right? You realize that you're half done. How many weeks to go? Yeah, his review is like 1, 2, 3, 4. That's it, right? You don't have to tolerate me anymore after 4 weeks, okay? I'm not gonna bug you guys. So just 4 more weeks, torture, okay? Sorry for that. So unfortunately, you have to tolerate me for 4 weeks. Uh, I'll 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 be I'll try to be easy, okay? But hey, I don't want to go completely easy, but my goal is to bring a huge big smile on your face on your uh, last day of the course when you take the final exam, and that's why I'm gonna keep pushing. So hey, I always say this. Please forgive me for that. My sincere apologies. Um, I may steal some of your precious time, which you probably spending with your family, but it's worth it. Just keep working, keep working, keep working. Whenever you're tired, ask yourself, why are you here? What is your goal? Right? What is your goal? So always push yourself as much as you can, right? And then doing so, if you feel overwhelmed, I'm here for you. I'm not going to leave you alone. Anytime you need my help, just reach out to me. If I'm not answering, maybe only time I'm not going to answer is that, hey, I just cannot answer. That is the only time. Otherwise, I won't. And if you need any urgent help, call me on cell phone. You guys have my number, right? You guys have my number or no? Yeah?
Yes.
Okay. So anything urgent, call me. I'll answer your call. Okay. Always remember this. You are very important for me. Okay, you're very important for me, because I value my students. You're the future. Okay, one day I'll be gone. You gotta bear the hold the torch, right? So what I'm giving you, keep it with you and do good for others, right? Because I always remember the first day I said, I want you to be super nurses, not just nurses, not any ordinary. No, ordinary people can make a difference. Extraordinary people make difference in people's life. Do the right thing. Never take shortcuts. Shortcuts might seem easy in the beginning, not worth it. They're not going to take you anywhere. There are a lot of ordinary people. Okay, be someone who can make positive difference. As I said, I want to bring this, I want to see a smile on your face, and just do the same thing with your patients. Bring a smile on their face, do well, good for them, right? And who can do that? Who knows what they're doing, not who just guessing. You need to know it. And being super nurse is not easy, but it's very rewarding, very rewarding. Nothing is going to give you more satisfaction. Trust me, when you are on the floor, seeing that smile on their face, when they say thank you, their family say thank you will understand what I mean by that. Yes, we all need money. Yeah, we go from work for money, but hey, there are other things which makes a difference, about what you do. Okay. So good luck to everyone. Keep pushing. And as I said, I'm here for you. Let me know. And always, always, always know what is important. Prioritize as a nurse. You will be tired. You will feel overwhelmed. There are gonna be distractions, a good movie, somewhere else. People are going somewhere else. Whenever you're stuck, you will see people going everywhere freely. It happens, right? So you feel like, why me? Remember, you're here to achieve bigger goals. Achieving bigger goals require bigger sacrifice, but only in the beginning. Okay, it will give you a whole lot which you can enjoy with yourself, your families at a later point. You won't even remember these days, but you will enjoy. From wherever you stand that day on that platform, you're gonna enjoy it. So if you feel overwhelmed, tell yourself like, okay, it's normal to feel overwhelmed, but let me just shake my head and figure out what the problem is. Why I'm feeling overwhelmed? Is it that I started late, or is it too much? Too much is what it means is that there's too much stuff I need to cover in too little amount of time. Well, that means that we need to bring some time wherever we're spending, which is not productive at that time. Well, that might be important as well, but just say, pretty please, cherry on the top, can I steal this hour or two from there? I'll give you back later on. I'm not going to watch a movie right now. I'm going to use those 2 hours to catch up on this, right? So manage your time well. Next, know what to focus on. Remember, there are tons of books on every subject. Pharmacology, tons of books, tons of resources, quiz bank, this and that. Don't try to know everything. Okay, as I said, first thing is what to know, what to focus on. And that's where it comes is what is important. Okay, focus on that. Once again, thank you for your time and sorry for the torture and this extra 15 minutes for this. But I love to talk to you guys. So hopefully you guys don't mind. Um, Relax for a little bit. And once again, tell yourself, I don't have time for that, right? I have time for that and get back on track. Studies, push hard on this exam, do well, and you'll pretty much be done with more than half or half and less left after that, okay? But you are doing well. The little improvements here and there, please look at my feedback and try to improve in there. But in general, you guys are doing quite well. Okay. So thank you for your hard work.
Thank you.
Thank you so much, Professor.
You're very welcome. Take care.
Thank you. Good night.
Good night.
Thank you,
Bye-bye.
Professor. Bye-bye.
Bye-bye. Jared is enjoying there. Okay, he's gone. All right, all right, all right. Janet, Zainab, how's everything going? All good?
It is
Yes.
good. Thank you, Professor.
You're most welcome. Let me know if you ever need anything, okay?
Sure. Thank you.
Okay, bye-bye.